Let's talk about something most men would never connect to their erections: how and when they drink water. Not supplements, not pills, not testosterone, but water.
Now, I know that sounds overly simple, maybe even dismissive, but stay with me because what I'm about to show you is not just about staying hydrated, it's about optimizing one of the most overlooked yet essential biological foundations of male sexual function. In fact, in urology clinics, we're seeing a consistent pattern that many men miss. Mild chronic dehydration is silently undermining blood flow, hormone signaling, pelvic nerve sensitivity, and even nocturnal erections. And it doesn't always look like thirst, it looks like fatigue, foggy thinking, reduced morning erections, difficulty maintaining stiffness, and it can look like premature aging of the penile tissues.
Now, here's the uncomfortable truth. Most men, especially over 40, are drinking water in ways that actually stress their erectile system. They chug large amounts late in the day. They caffeinate early and often. They ignore subtle thirst cues until they're already behind. And they rarely think about how hydration impacts the vascular, neurological, and pelvic floor systems that all work in harmony to produce an erection. And if you've ever said to yourself, my libido is fine, but I just can't stay hard like I used to, or I wake up to pee a lot and it's killing my sex life, then you're in the right place. Because today we're going to unpack exactly how water, yes, just water, plays a profound role in your erection quality, stamina, and urinary confidence.
This is something I hear all the time in clinic.
Doug, I'm doing everything right. I'm eating clean, I take supplements, I'm even exercising. Why does my erection still feel off? And often we have to zoom out, look upstream. Because sometimes it's not a testosterone problem, it's not a porn problem, it's not a relationship problem.
It's a pelvic floor, bladder irritation, or vascular hydration problem.
And no, that doesn't mean drinking a gallon of water randomly throughout the day. It means drinking water strategically in a rhythm that aligns with your body's erectile physiology. So, in this video, we're going to explore that link with science, with compassion, and with no shame. We'll walk through the surprising connection between hydration and penile blood flow, how bladder pressure and pelvic floor tension sabotage erection,
Why your coffee habits may be making your erectile symptoms worse. Well, not just how much to drink for optimal sexual function.
a myth busting look at hydration supplements like electrolytes and male performance drinks, and finally, my clinic tested hydration protocol to support natural, healthy erections, especially if you're over 40.
Because here's what I want you to hear clearly:
You are not broken.
your erection is not gone.
Your body is just asking for balance, and it starts with something as fundamental as water.
So take a deep breath. This is common and it's okay to talk about it.
Let's dive in without judgment, just truth. Before we dive into the specifics, let me walk you through the 6 key insights we're going to explore in this consultation, each one like a chapter in your personal owner's manual for better erections. First, we'll look at the silent but powerful role of blood plasma volume in achieving and sustaining an erection. Think of your blood vessels like flexible pipes, and without enough fluid, those pipes simply can't deliver the pressure needed for rigidity. We'll break down how even mild dehydration reduces blood volume and triggers stress hormones that weaken your vascular function. Second, we'll explore how dehydration directly affects your pelvic floor muscles and why tension in this area can choke off both blood flow and nerve signaling to the penis. If you're clenching without realizing it or waking up to pee more than once a night, your pelvic floor may be sending distress signals rooted in fluid imbalance. Third, we'll tackle the caffeine conundrum, not to demonize coffee, but to explain how early morning caffeine without prehydration can hijack your adrenal system, dehydrate your tissues, and spike cortisol in ways that shut down healthy nitric oxide pathways, the very ones responsible for erection. Fourth, we'll look at the timing of water intake and why when you drink may be just as important as how much. Men who hydrate late in the day often wake up multiple times at night, disrupting testosterone production and REM sleep, both essential for nocturnal and morning erections. Fifth, we'll shine a light on electrolytes and hydration myths. From sports drinks to performance supplements, We'll talk about what's actually helpful and what may just be expensive urine, especially when it comes to sexual performance claims.
And six, we'll put it all together with a clinician tested hydration rhythm tailored for men over 35, designed to reduce nighttime urination, support steady energy, and optimize erection quality without overloading your kidneys or bladder. Each of these chapters will bust a myth, clarify a misunderstood symptom, and give you one or two simple science backed actions to start using today.
If any part of this resonates with you already, maybe you've been wondering about that connection between your bladder and bedroom, feel free to leave a comment below. You're not alone. Thousands of men are asking these same questions silently. And if you want more clear, research backed insights like this without the medical jargon or shame, hit that subscribe button. We're just getting started. Let's start with the foundational truth that often gets overlooked.
An erection is, at its core, a blood flow event.
It's not just about hormones, it's not just about desire, it's about hydraulics, and you need enough fluid in the system to create pressure. Here's what I mean: your body holds blood in a delicate balance. About 55% of your blood is plasma, and plasma is over 90% water. When you're even slightly dehydrated, your plasma volume drops. That thickens your blood, narrows your vessels, and makes it harder for the body to send a surge of blood into the penis quickly and effectively. Think of it like trying to fill a water balloon through a kinked hose. There just isn't enough pressure. Now imagine your vascular system trying to fill the corpus cavernosum, the sponge like erectile tissue without enough fluid in the pipes. It's not about not trying hard enough or not being attracted, it's about biology not being supported.
A 2020 study in the Journal of Andrology found that men with lower plasma volume, even without overt signs of dehydration, had a higher risk of erectile dysfunction, especially those over 45. They also had elevated vasoconstrictors like angiotensin II, which narrow blood vessels and blunt erectile response.
But there's more. Dehydration doesn't just reduce blood volume, it triggers stress hormones, particularly vasopressin and cortisol. Vasopressin tries to hold on to water in your kidneys, but it also constricts blood vessels. Cortisol, it can dampen testosterone production and interfere with nitric oxide signaling, the key chemical that opens up blood flow to the penis. So, in real terms, what does that look like? You might notice that
Your morning erections aren't as strong or frequent.
it takes longer to get aroused or stay firm. Your penis feels colder or less responsive,
You feel foggy, fatigued, or low energy before intimacy.
and all of this can be worsened by something as simple as waking up dehydrated and running on caffeine until lunch. Your erection is trying to function with less fuel and more resistance. Now, here's what I tell my patients: hydration isn't just about drinking more, it's about staying ahead of thirst. By the time you feel thirsty, your body is already playing catch up. Your plasma is already concentrated. Your hormones have already shifted.
So here's your first action step.
Start your day with 12-16 ounces of plain water within 30 minutes of waking. Before coffee, before food, before email, just water.
This simple ritual rehydrates your plasma volume after 7-9 hours of fluid loss through breathing, sweat, and urine production. Why does this matter?
Because most men wake up in a vasoconstricted, dehydrated state, especially if they snore, mouth breathe, or consume alcohol at night. That constriction reduces the morning surge of blood flow, impacting not just your erections, but your focus, motivation, and mood.
I also recommend keeping a glass of water by your bed. And if you tend to wake up at night to urinate, we'll cover that later. Don't worry, there's a fix for that too. But the key here is to treat your blood like a hydraulic system. No water in, no pressure out. Your erection isn't a mystery, it's a pressure dependent response. And pressure needs volume. Not gallons, just rhythm, just consistency. Now, let's move deeper because your blood vessels are only part of the story.
Next, we're going to talk about your pelvic floor muscles and how dehydration may be causing them to clench, spasm, or interfere with erection without you even realizing it. Now, let's look at the second system you've probably never associated with drinking water: your pelvic floor. The pelvic floor is a group of muscles that sit like a supportive sling at the base of your pelvis, running from your tailbone to your pubic bone. For men, these muscles play a crucial role in erection, ejaculation, bladder control, and even bowel function. And here's the part most people miss: these muscles respond directly to fluid balance, especially through their interaction with your bladder. Think of your pelvic floor like a hammock. It needs to be strong enough to support the organs above it, but also supple enough to relax when needed. But what happens when your body is dehydrated? The bladder lining becomes irritated. The urine becomes more concentrated, darker, more acidic, sometimes with a stronger odor. This acidic environment can stimulate the bladder wall, triggering frequent urges to urinate, even when your bladder isn't full. That phantom urgency can cause the pelvic floor to tighten defensively. Now, here's where it links to sexual function. When the pelvic floor is overly tight, what we call hypertonic, it can constrict blood flow to the penis, compress pudendal nerves that control arousal and ejaculation, create a sensation of premature ejaculation or pelvic pain during arousal, interfere with the full relaxation needed for spontaneous, firm erection.
Many men who experience sudden drop off erections, where you get hard but lose it quickly, are actually dealing with pelvic floor guarding, not psychological performance anxiety.
And dehydration plays a direct role in this. Because when your bladder is irritated, your brain stays on alert. Your pelvic floor clamps down, your nervous system shifts into sympathetic dominance, that fight or flight mode, and the body doesn't prioritize erection in fight or flight. It prioritizes survival. A 2018 review in the Journal of Sexual Medicine emphasized how pelvic floor dysfunction is both underdiagnosed and deeply linked to urinary urgency, bladder irritants, and dehydration, especially in men over 40. And when the bladder is unhappy, the penis pays the price. So here's what you can do. 1. Start tracking your urine color and frequency.
Pale straw colored urine every 2 to 4 hours is ideal. If it's dark, cloudy, or you're urinating every hour or waking more than once at night, your bladder may be irritated.
2. Practice intentional pelvic floor release. Take 60 seconds twice a day to sit in a relaxed position and breathe into your belly. As you exhale, visualize your pelvic floor softening like the bottom of a balloon, gently lowering. This helps retrain your brain to downshift from tension. And here's something I often share with patients.
Your pelvic floor is not just a muscle group, it's a messenger. If it's tense, your body might be trying to protect you.
Hydration helps calm that alarm system.
Regular steady fluid intake helps your bladder stay content, and when the bladder relaxes, the pelvic floor relaxes, and when that relaxes, erections happen more naturally.
If this is something you've never thought about but suddenly makes sense, you're not alone. Leave a comment below if pelvic tightness, urinary urgency, or unexplained edging issues have affected you. It's more common than you think. And if you're finding this helpful, go ahead and subscribe so you don't miss upcoming deep dives on things like prostate health, hormone rhythm, and more. These are conversations men deserve to have, without shame and with real solutions. Up next, we're going to talk about one of the biggest unrecognized saboteurs of hydration and sexual performance: your morning coffee habit. Let's talk about something sacred to many of us: coffee. Now, I'm not here to demonize caffeine. In moderation, coffee can support mental focus, metabolic health, and even offer antioxidant benefits. But if you're relying on coffee to wake up while skipping water first thing in the morning, there's a silent cost that shows up in your hormones, your nervous system, and yes, your erections. Let's break this down without judgment. Just truth.
Caffeine is a diuretic, meaning it increases urine production. That's why so many people have to pee shortly after their first cup. But what's rarely discussed is this: when you start your day dehydrated after 6 to 8 hours of fluid loss through breathing and urine concentration, and then layer on a double shot of espresso, you're accelerating fluid loss before you've even begun rehydrating your blood plasma.
And as we covered earlier, less plasma means less blood volume, and that means lower hydraulic pressure for erection.
But there's more. Caffeine stimulates your adrenal system, releasing cortisol and adrenaline. These are your stress hormones, designed to give you energy and alertness. Great for crushing a meeting, not so great when you're trying to relax into intimacy.
Here's why erections are a parasympathetic process, your rest and digest system. But caffeine pushes you into sympathetic dominance, fight or flight. In that mode, your body diverts blood away from the reproductive organs and toward your muscles, lungs, and brain. That's why too much caffeine can make you feel jumpy, anxious, or tense, and it's also why it may be harder to achieve or maintain an erection when you're overstimulated. Now, some men say, but I've had great sex after coffee. And that's fair. We're not talking about one espresso before a romantic evening. We're talking about the daily ritual of waking up already dry and immediately triggering stress hormones before giving your body a chance to recover its fluid balance. The Journal of Applied Physiology has shown that caffeine intake above 200 milligrams, that's just two small cups, can significantly increase vasopressin, the antidiuretic hormone. While this hormone helps your body retain water, it also raises blood pressure and narrows blood vessels, which can reduce the relaxation required for erection. So, what's the takeaway?
You don't have to give up coffee, but you do have to resequence it.
Here's your action step. Drink 12-16 ounces of water before your first cup of coffee every day. This one habit can reduce cortisol spikes, prevent adrenal fatigue, and replenish plasma volume, all of which support better sexual and vascular health.
Bonus tip, add a pinch of sea salt or a squeeze of lemon to your morning water. This adds trace minerals that support hydration, especially if you're prone to sweating or live in a hot climate.
And if you're experiencing any of the following: early fatigue after sexual arousal, a sense of numbing or disconnect in the genital region, irritability, brain fog, or energy crashes midday, it's worth exploring whether your caffeine hydration balance is out of sync. Remember, this isn't about guilt, it's about understanding your body's rhythm.
If you're always running on cortisol and caffeine, your parasympathetic nervous system, the one that allows you to soften, connect, and maintain an erection, never gets a chance to take the lead. So ask yourself,
What would it feel like to wake up replenished instead of depleted? To support your sexual system from the moment you open your eyes. It might start with something as small and as powerful as a glass of water before coffee.
coming up next, let's dive into when you drink water because timing matters just as much as quantity, and many men are sabotaging their nighttime erections without realizing it.
Let's shift the conversation from how much water you drink to when you drink it. Because if you're waking up at night to urinate even just once and wondering why your morning erections feel weaker, less frequent, or absent altogether, this section is for you. Here's the physiology behind it. Your body does most of its testosterone production in penile tissue repair during deep sleep, particularly in the REM cycle. This is also when you're supposed to have several spontaneous nocturnal erections, not just as a sign of arousal, but as a natural process that oxygenates the erectile tissues, maintains elasticity, and supports overall penile health. But here's the catch. If you're drinking most of your fluids in the late afternoon or evening, trying to catch up, you're overloading your bladder close to bedtime. That full bladder stretches the detrusor muscle and activates the micturition reflex, which tells your brain, hey, wake up and empty me.
That one wake up, even if it's quick, can interrupt your hormonal cycles. It reduces REM sleep, cuts into growth hormone release, and disrupts the cascade that supports testosterone synthesis and nocturnal erections.
Over time, this can lead to less frequent morning wood, reduced penile sensitivity, weaker erection firmness, daytime fatigue, irritability, and low libido. And here's the kicker: most men think this is just aging. It's not, it's often hydration mismanagement.
A study published in BJU International found that men who experienced nocturia waking up at night to urinate had significantly lower testosterone levels independent of age, and even more important, correcting fluid timing often improved both sleep quality and sexual function within weeks.
Let's bring this back to something simple and actionable. Here is a hydration timing protocol I often share in clinic. 40% of your total daily fluid intake should happen before noon. Another 40% between 12 and 4 p.m. Only 20% between 4 p.m. and bedtime. For most men, that translates to 16 hours unawakened,
8 hours mid morning,
8-12 hours at lunch,
8 hours mid afternoon.
then taper down for 6 hours with dinner and sip lightly after that if needed. The goal is not to dehydrate yourself in the evening, it's to front load hydration, so your bladder isn't carrying the burden when your body is trying to rest, repair, and replenish testosterone. Some men say, but I'm thirsty at night. That's often a result of not drinking enough during the day. Your body's trying to make up for it. Once you shift your hydration earlier, that late night thirst usually fades on its own. One more thing, if you do wake up to urinate at night, pay attention to the urgency and volume. A small urgent trickle may indicate bladder irritation or pelvic floor tension, not true fluid overload, whereas a large volume suggests your timing needs adjusting. So here's your action step. Track your fluid timing for 3 days. Notice when you drink most of your water. Are you jogging at night to make up for a dry morning? Are you drinking coffee all day and realizing you forgot water until dinner? These patterns matter.
Hydration is not a one time event, it's a rhythm, and when you respect that rhythm, your erections benefit.
Up next, we'll separate fact from fiction with hydration supplements, electrolytes, performance drinks, male vitality powders, which ones actually support sexual health, and which are just clever marketing. By now, you understand that hydration is essential for erections, but the wellness industry has caught on too, and it's flooded the market with performance hydration powders, packets, and drinks, many of which claim to enhance energy, blood flow, stamina, or even libido.
So let's clear the confusion. Do you need electrolytes or specialty drinks to improve erections, or is plain water enough?
Here's the clinical truth. For the average man who eats a balanced diet and isn't losing large amounts of fluids through sweat, you do not need added electrolytes to stay hydrated. In fact, oversupplementing can cause more harm than good. Let's break this down.
Electrolytes like sodium, potassium, magnesium, and chloride are minerals that help regulate fluid balance, nerve conduction, and muscle contraction. They're important, yes, but your body is excellent at managing them if your kidneys and hormones are functioning properly and you're eating whole foods. The average man gets adequate electrolytes from a pinch of sea salt on food.
Leafy greens and bananas for potassium, nuts, seeds, and legumes for magnesium, proper hydration throughout the day. Now, if you're working out heavily, sweating profusely, or on a low carb or ketogenic diet where insulin drops and sodium is excreted more rapidly, you might benefit from targeted electrolyte support. But for most men, particularly those with erectile concerns, here's what to watch out for.
1. Oversalted hydration powders. Many performance drinks contain excessive sodium, 500 to 1000 milligrams per serving, that can raise blood pressure, which is a known contributor to erectile dysfunction, and it doesn't address the root issue, blood vessel health, and nitric oxide signaling.
2. Added caffeine and stimulants. Some male focused hydration drinks include guarana, green tea extract, or yohimbine, which might feel energizing but push your nervous system into sympathetic overdrive. Remember, erection is a parasympathetic process. More stimulation often means less flow to the penis. 3. Artificial sweeteners and sugar alcohols. These can irritate the bladder, especially sucralose and sorbitol. If you're drinking these products and experiencing frequent urination, urgency, or pelvic tension, they may be part of the problem. 4. Hidden testosterone claims. Some products suggest male performance enhancement through vague wording, but the ingredients are often just electrolytes, caffeine, and vitamin B12. These don't meaningfully improve erections if your root issues are hydration rhythm, blood flow, or pelvic floor tension. So, what does work? Magnesium is one of the few minerals consistently shown to support testosterone regulation and blood vessel relaxation. A 2011 study in biological trace element research found that men with higher magnesium levels had significantly higher total and free testosterone. Potassium helps balance sodium and supports smooth muscle relaxation, essential for vasodilation in erectile tissue.
So here's your action step.
If you want to try electrolyte support, skip the flashy powders. Instead, try this simple, clinically balanced formula: 8-12 oz water, water. A small pinch of sea salt, not table salt. A squeeze of lemon, natural source of potassium and citric acid. Optional 100-200 mg magnesium glycinate or citrate if your diet is low in leafy greens or nuts.
This combination hydrates gently, supports nerve and muscle function, and avoids the overstimulation that sabotages parasympathetic tone.
And remember, if you're experiencing fatigue, brain fog, low libido, or a lack of morning erections, don't rush to buy a performance drink. Start with the basics: consistent water intake, pelvic floor relaxation, better sleep hygiene, and then fine tune if needed. Your erection is a barometer of your vascular, neurological, and hormonal balance, and no powder can override poor rhythm. Next, let's bring it all together.
In our final insight, I'll walk you through a full hydration protocol for erection health tailored specifically for men over 35 who want real sustainable results without gimmicks or guesswork. Let's pull everything together into one clear, evidence backed routine because you don't need to guess anymore. You deserve a simple, practical system that supports your erections, your bladder, and your overall vitality without pills or hype.
What I'm going to share with you now is a hydration rhythm I've fine tuned over years of working with men, particularly those 35 and older, navigating the hormonal shifts, vascular changes, and lifestyle pressures that subtly interfere with sexual health. This protocol isn't about drinking massive amounts of water. It's about strategic timing, mineral support, and listening to the signals your body's already giving you, often quietly. Let's walk through it, step by step.
Step 1: Morning rehydration. The foundation.
Within 30 minutes of waking, drink 12 to 16 ounces of plain water. Why? Because during sleep, your body loses water through respiration and urine, yet you're not drinking anything. This leaves your blood thicker and your erection mechanism sluggish. Rehydrating early support
Plasma volume restoration.
morning testosterone rhythm,
Blood vessel responsiveness.
cognitive clarity, and energy.
Optional enhancement: add a pinch of sea salt and a squeeze of lemon for trace minerals and gentle alkalinity.
Do this before coffee. Always, this prevents caffeine from depleting your fluids further and keeps cortisol surges in check.
Step 2: Hydration anchoring. Late morning and midday.
Between 9 a.m. and 1 p.m., drink another 20 to 24 ounces, broken into 2 servings.
This supports energy, circulation, and keeps your bladder calm before your workday ramps up.
Pair this with your meals if possible, sipping slowly. Water before or during meals helps with nutrient absorption and satiety. If you're eating salty or protein rich foods, even better. Hydration helps your kidneys process urea and sodium efficiently. Step 3: Afternoon support. Maintain, don't overload. Between 1 p.m. and 4 p.m., aim for 16 ounces spaced out. This helps you stay alert without the crash and keeps fluid levels consistent as your body naturally begins winding down its hormonal and digestive activity. But here's the key: start tapering. This is not the time to catch up on water intake. Step 4: Evening taper. Protect your sleep and erection from 4 p.m. to bedtime. Limit yourself to 8-12 ounces total, ideally finishing by 7 p.m.
This protects your REM sleep, your nocturnal testosterone production, and your morning erections. Remember, even one nighttime awakening to urinate can interfere with the deep hormonal cycles that support sexual function.
If you exercise in the evening and need rehydration, sip slowly and consider replenishing with a small amount of electrolyte rich food like a banana or a handful of unsalted nuts instead of chugging fluids. Step 5: Listen to your body's signals, not just thirst. Your body whispers before it screams. Signs of subtle dehydration that often precede thirst include
Dry eyes or dry mouth.
Mild headache or irritability, fatigue or low motivation, fatigue or low motivation, low participation, cold hands or feet, a drop in erection, firmness, or frequency. When you notice these, pause. Don't panic. Sip water slowly, do some deep belly breathing, and avoid jumping straight to caffeine or sugar. Often, what your body's asking for is support, not stimulation. Step 6. Monitor your urine erection.
Your urine is one of your body's best feedback loops.
Aim for pale yellow urine, not clear or dark. Voiding every 2.5 to 4 hours during the day, no more than once per night, ideally none. Consistent morning erections, even partial ones, show that your system is working. And don't obsess over one day or one erection. Patterns are what matter.
Remember, your body is not fragile, it's responsive. And often, what feels like a performance problem is really just a hydration rhythm problem, one that can be gently corrected with consistency, awareness, and care.
You don't need to buy into expensive powders or extreme regimens. You need to give your body the basics with intention. Next, let's move into the final section, a compassionate, science grounded conclusion to recap what's normal, what's not, and what you can do starting today to support your sexual health with confidence. Let's come full circle.
If you're over 35 and noticing changes in your erections, whether they're softer, less frequent, slower to respond, or just not as reliable, I want you to hear this clearly.
You are not broken, you are adapting. Your body is responding to real, measurable shifts in hormones, circulation, pelvic nerve sensitivity, and emotional context. That doesn't mean you're declining, it means it's time to listen more deeply and support yourself more intentionally.
You've now seen the 6 core insights.
How dehydration silently weakens erections. The link between blood volume and blood flow to the penis. Why electrolytes matter more than just plain water. The impact of caffeine, alcohol, and medications on erection hydration. How bladder irritation and pelvic tension sabotage. Sexual function. A urologist approved daily hydration protocol to optimize erection.
Each one points to the same truth.
Erections aren't just about arousal, they are about circulatory integrity, nervous system regulation, pelvic harmony, and total body hydration.
This means that every small act of support, from your morning water routine to your choice to stop fluid intake after 7 p.m., isn't just for your health, it's for your confidence, your desire, and your sense of agency over your sexual wellness.
Let's clear up a few common myths so you can stop wasting time and energy on the wrong solutions.
It's not always a testosterone problem, often it's a microcirculation issue worsened by dehydration or lifestyle factors.
It's not always psychological. Emotional stress and mental fatigue matter, but physical patterns like bladder overactivity and pelvic tension drive these problems too.
You don't need to jump straight to pills. Most men respond within 3 to 6 weeks to lifestyle based erection support strategies, especially those that restore hydration, mineral balance, and nervous system tone.
So, what can you start today? Here's a quick action checklist to gently reset your erection system. Drink 12-16 oz of water within 30 minutes of waking before coffee. Add a pinch of sea salt or trace mineral drops to 1 glass per day. Stop drinking fluids 2-3 hours before bedtime to protect sleep driven testosterone.
Avoid alcohol and caffeinated beverages in the late afternoon or evening.
Address bladder irritants like spicy foods, acidic juices, and carbonated drinks. Spend 5 minutes daily doing deep belly breathing to soften pelvic tension. Notice your urine pale yellow with no more than one nighttime wake up is ideal. Track morning erections. They are an important sign, not a performance test. Finally, I want to invite you to reframe how you view your sexual health.
Instead of seeing it as a performance issue or a ticking biological clock,
see it as a feedback loop, one that you can improve by tuning into your hydration, your sleep, your nervous system, and your pelvic health. Because supporting your erections isn't just about sex, it's about circulation, energy, mood, motivation. It's about how you show up for yourself, for your partner, for your life. You're not just managing symptoms, you're building vitality, one smart choice at a time. So drink with intention, breathe with presence,